afraid of it because it means that they know people will leave them unless they change their practice. I mean, they've got all these contracts with doctors, they've spent all this money with marketing, they've got all these customers. If people like them so much, they won't leave. When they say people are going to leave, it's because they're worried that if they don't do a good job, people will leave them for an insurance option that puts the public first and puts the consumer and the patient first.
Well, even physicians in practice, private practice, are told what to do. So they don't have the freedom to practice medicine as they should have. And it's kind of one size fits all. They will say only one test here or no test of that sort here. This country has spent a lot of taxpayers' money in research to find breakthroughs and lots of remedy for any kind of illness, pretty much. And yet, when they get an illness, though they have paid in just like everyone else to arrive at an answer, the hospital or the physician is not able to do what they think it calls for.
And contrast with Medicare. I mean, people say we don't have national health insurance in this country. We do. It's called Medicare. And everybody over 65 has health insurance through Medicare. And in Medicare, doctors can do what they want. And believe it or not, even though doctors can do what they want, Medicare has a better job of controlling healthcare costs than private insurance. Medicare goes up about 4.5%. Private insurance goes up 7.5%. And yet Medicare doesn't have the insurance company coming between the patient and the doctor. So we can see that public health insurance really works, and we look how Medicare works well for our seniors, and we want to give that same option to everybody under 65 as well.
Well, you know, the interesting thing is that most people are relatively well until they get to over 50, around 65. At 65, they get dumped into Medicare, and the insurance backs off until Medicare pays first. And so there is really not a good point that insurance put out too much, because all of us know that when people get 50, 60, 65 is when they need medications for some chronic illness or whatever, and that's a government-run program.
Right, and it does a great job, and people love it, and you know, people would never want their Medicare taken away from them. Excuse me. So that shows that, you know, when it comes to health care, the government can do a good job, and that's what Medicare is about, and people love it. And what we're saying, what folks like you in Congress are saying, let's give that option, not a requirement. Let's say to people, you like your private insurance, you can keep it, but if you want a choice of a public health insurance option, you can choose that too. It's your choice. It shouldn't be the choice of anyone else.
If the insurance companies are very threatened by that, they must have some suspicion that they're not pleasing their customers.
Right, and you know what the research shows is, you see polling that says people like insurance. Then if you look beyond that, the people who have been real sick, they're not so hot on insurance, like you were saying before. Because when you've had a lot of experience with the healthcare system, that's when, particularly expensive conditions, that's when the insurance company is more likely to come between you and your doctor, question that test, or refuse the care that you need.
Well, they're spending a lot of money on the airways, as well as many, many, many lobbyists. There's no end to the numbers, and they're getting paid very well. But also on the airways, they're saying they don't want this government-run, nothing government-run is good. Well, we've had some successes with government-run plans. Social Security is one of those. Medicare is another one. So I don't see where that's such a bad thing.
You know who gets the lowest prescription drug prices in this country? It's the Veterans Administration. So there you
That's
have
right, it's government-run.
Government agency, and the Veterans Administration uses its bargaining clout to lower the prices that they pay for prescription drugs. And everybody knows that, you know, around the world they pay much less for prescription drugs than the United States. But the one place that's not true in the United States is if you go to the VA system, because they do what other countries do. They use their bargaining clout. So here's a case where government has used its bargaining clout to get lower prices. And the idea between a public health insurance option is you have an insurance company that could use its bargaining clout as a public entity to get lower prices, and also to be sure that you cut out the overhead and the profits and the high salaries that you're paying these insurance company executives, so that those savings can get passed on to the consumer.
Well, I know that in the bill that was passed, I think it might have been 2006, for medications and insurance and Medicare, there was a prohibiting statement in there that would not allow the Health and Human Services Secretary to negotiate prices, which I thought was pretty Neanderthal.
Right, it was written by the insurance companies and passed by the Republicans in Congress at that point, and 2003, I think it was, or 2004.
Okay.
And basically, yeah, it basically said that it prohibits the government from negotiating for better prices. And that's just crazy, because so what happens right now is when you're in Medicare, in the Part D, one of the reasons that there's that big donut hole that your insurance stops paying is because there's not the rates are too high. Well, one of the things that's good about the legislation that the House is looking to pass, H.R. 3200, is it would start to close that donut hole. And there are a lot of, I think, for all the skepticism, what the House is doing in H.R. 3200, there's a lot of really good things in there. It would mean that when you'd work, your employer has to help pay for your coverage. It would mean if you don't get coverage at work, your coverage would be affordable. It would mean you have a choice of a public health insurance option. For seniors, it would start to close that donut hole. So there's a lot of really good things in H.R. 3200, and we think it's really the model bill for health care reform, and we're really hoping something like that gets passed by Congress at the end of the day.
Well, I'm certainly on that side, and I can say that I have not been lobbied by the insurance companies. I think I've made my position pretty clear.
They're not wasting their breath, right?
Yeah, and most people that know me know if I make up my mind and think I'm right, I'll stick with it. I think, too, that they have brought so much public information through our airways that it's very good to have a grassroots organization of real people that are talking about what they're experiencing with their health care. We have the largest number of uninsured people in the country in Texas.
Wow.
And we don't see anybody getting that concerned about it. They continue to give the care, but it's really driving our public hospitals out of business. And we pick up that tab through our property insurance. And so some of us, including me, need a little relief from that. So we need another way to make sure that people get health care without it coming directly through our property taxes, because that's exactly what we're doing now.
It would make a huge difference in your community in Dallas if all those folks, I think it's 1 out of 3 folks now, don't have insurance. Instead, if they paid something what they could afford for insurance, had good insurance, got to the doctor when they needed to early, got better care, didn't end up in the emergency room, less strain in your hospital, they'd be healthier, less strain on, as you say, the property tax, save the system a lot of money, and be a lot more humane, because it's terrible. I mean, one of the things that people sometimes forget is that over half the bankruptcies in this country are because of medical debt, and that's just got to stop.
Yes, that's true. In my district, we had something like 9,000 bankruptcies, and about 85 or 90% of them were caused by large medical bills. Wow. So we really need a change, and we have been kind of lax, I think, in my state of Texas, in attempting to set some rules for the insurance companies to function by, because they function pretty freely. If they want to insure you, okay. If they don't, they feel okay about it. And I think that everyone is taking a risk except the insurance companies. They're not taking a risk. They insure people that are healthy. If they happen to get sick, then they threaten with whether they will pay for all they need. I've seen the expense go up with health care coverage, because often physicians have to wait 2 or 3 days for them to approve some type of test, which means it keeps people sometimes in the hospital a number of days longer. And then there are insurance that will only cover